Hi, my name is Jessica Hundley, and I'm presenting the Nurse Educator Teaching Tomorrow's Nurses. One of the reasons I thought it would be interesting to present on this topic is due to the shortage of nurse educators. The use of the virtual classrooms, such as the one that we're in now, and then also just the direction that we're heading in healthcare and just using more virtual ways to reach both patients and students. According to registerednursing.org 2019, nursing education is in extremely high demand. The American Association of College of Nurses reported almost 65,000 qualified applicants being turned away from nursing school due to not having enough nurse educators. Some of the qualifications to become a nurse educator, according to registerednursing.org 2019, is you must first pass your registered nursing and NCLEX RN examination, and then also have a master's level of nursing. You either need a master's or doctoral in nursing and a post-secondary certification in nurse education, or you need a master's or doctoral degree in nursing and then 9 or more credit hours towards a graduate degree level of education courses. The Florida statute for the Nurse Practice Act 2020 outlines specific requirements for an institution to teach nursing students. The program director, as well as 50% of their faculty staff, should have a master's in science of nursing or higher degree. Certification as a nurse educator is available through the National League for Nursing and requires 2 years of full-time teaching within the last 5 years or a master's degree in nursing. That's according to Blaze and Hayes 2016. Some of the major job responsibilities for a nurse educator includes designing curricula, teaching, obviously, and then advising or evaluating students, promoting discussion or dialogue among the peers, overseeing their clinical practice as well. Engaging in scholarly work, speaking at nurse conferences, and maintaining clinical competence are some of the standards of care for nurse educators. The National League for Nursing compliments themselves on being the premier organization for nurse educators, according to National League for Nursing 2020. The impact of the nurse educator as far as the nursing shortage goes, according to registerednurse.org 2019, the United States Bureau of Labor Statistics reports between 2014 and 2024, post-secondary nursing educator or teachers are expected to see a 19% growth rate in employment, and that is above average growth rate. According to Online Sunshine 2020, the Florida Statute 464.019 states the care outcomes includes preparing students for the practice of professional nursing, assessing student learning outcomes, and then also assessing the teacher's ability to teach the content. According to Blaze and Hayes 2016, the Patient Protection and Affordable Care Act, which was passed by Congress, United States Congress in 2010, outlines 4 key components for nurses. 1, nurses should work to the full extent of their training and their education. Nurses achieve higher education and promote seamless academic progression in their field. Nurses are full partners with physicians and other healthcare providers. And then last, better data collection so that we can improve information infrastructure. Nurses can make more money caring for patients at the bedside than they do in the classroom. So schools are quickly moving towards higher salaries for nurse educators to attract more nurses into education. That's according to registerednurses.org 2019. According to registerednurses.org 2019, educators continue to work in their field as professional nurses and they actively participate in organizations as well in order to stay up to date on the latest trends, the methods, the technology and developments that are available to the patients. One of the legal issues that was outlined by Online Sunshine 2020 includes practicing advanced or specialized trained nursing without having the proper licensure. This would be a third-degree felony, and that's according to statute 464.016. The quality of care measured by the nurse educator would likely most be evaluated by the students and their ability to learn the information that's being taught. Getting feedback on how clear and concise the information is that's being given to them would be critical. And then in conclusion, the nurse educators play such an important role for the nurses of tomorrow, using the technology to reach more students virtually. And also in the future, we just look forward to using telehealth more readily available for the patients and students learning alike, as well as the valuable resource of our simulation labs that offer real life situations for the students and see how they would react and give them critical feedback. It's a very exciting time for nursing. Please see my references listed at the very last slide.